AcuPulse is one of the newer CO2 fractional devices on the market. It's a different kind of device. It incorporates both superficial and deep into one device, but even more different than the other devices out on the market, it does that with one handpiece. So it's a lot more user-friendly per se than some of the other devices that may be out there claiming to do, a superficial or a deep fractional treatment. So for me, this is a wonderful device to be able to treat anything that I want on the superficial side, anything I want on the deep side, anything I want combination-wise, without having to stop, take off a handpiece, put on another handpiece. It's much easier as well for the user interface. To me, it's the simplest of the user interfaces that I use. So it's a go-to machine from that point. We sort of made it simple. So you have to understand the device, you have to understand what makes it different, which we'll talk about, but it's a user-friendly, next generation, if you will, CO2 fractional device. When I think of how you evaluate all of these fractional devices, the ultimate result is what I think about. So if somebody has made the decision with us that they're going to have an ablative fractional treatment, we already know that we're talking about, we talk 3 to 5 days of downtime, 5 to 7 days of downtime, 7 to 10 days of downtime. It all depends on how much energy you're using and creating damage. That determines how much downtime. So if we've made the decision that we're going to go the ablative route, my patients know they're going to have downtime. So that's a given. My job is to make sure the downtime is comfortable and that they're not in any kind of distress or problems, and that it's a simple recovery process. And that's what we expect with everybody that we treat. I like the speed of the device. That's a really important decision for me wanting to use an ablative device, because I like things that I can control and then go fairly quickly through the procedure, but at a controlled rate. But ultimately, it's what the device does at the end. And again, when you can do deep where you need deep, you can do superficial where you need superficial, and then we have a combination. And it's the combination of this together that my patients see the best results when I need it. And if you don't have the options, so you can take a device and go over something 2 or 3 times, maybe you'll get there, but each time you go over it, you're creating more damage. I'm creating the proper amount of damage under the skin that I want. And therefore, at the end of the day, I'm going to have the best results. So that's where AcuPulse is different. And that's why AcuPulse is a different modality when people look at, okay, I'm in the CO2 ablative fractional market. This is a device people need to think about, because it really does what it says it's going to do. Residual thermal damage is a big issue with all the devices we talk about. And when we talk about AcuPulse, it brings up the question of how much do we get on residual thermal damage. So most people know of the UltraPulse, which gives us the UltraPulse delivery of energy with this minute amount of thermal damage. And AcuPulse is super pulsed, so there's a little bit more of thermal injury. But again, our clinical trials have not shown this to be significant as far as causing problems such as PIH or increased risk of hypopigmentation or scarring in any way, shape, or form. The other thing that's different about this, and it's the key of what makes the AcuPulse different, we have one handpiece. So it started with what is equivalent of the Deep FX on the UltraPulse. So we have these 0.12 millimeter spots that we're delivering deep energy. But because we still have to work within that same spot size, delivering 1.3 millimeters didn't work in a 0.12 spot size. So we had to change how we delivered the energy, and we deliver it in a spiral formation. So we don't compromise the thermal relaxation time of water, and thereby we can still deliver the proper amount of energy, and we have no major concerns of residual thermal damage. The AcuPulse is a very safe treatment. When I start speaking about lasers and light sources in this day and age, I usually start by explaining to people that my skin color is not the norm anymore. we are not the majority. And if we only treat our skin color, any of these devices work. But if we can't treat darker skin types, Asian, Indian, where there are a lot more people, we're in trouble. Hispanic, Asian, Indian cultures. We have to be able to treat them and yet minimize the risk of post-inflammatory hyperpigmentation. So one of the things about AcuPulse is that as soon as it was developed, we first did a clinical trial actually to prove it worked. That was on Caucasians, looking at really fine lines and pigment, and we showed some very nice significant results there, doing deep treatments around the eyes and mouth and superficial everywhere else, and it worked great. So that paper is going to be in the literature in the next month or so. The other thing that we did working with Lumenis was to take this device and treat a range of patients of skin of color. So we actually had Hispanics, we had Asians, and we had Indian patients and African American patients involved in a skin of color look to make sure that when we did this, it was safe and effective. So we did a bunch of treatments on a group of patients, multiple treatments on occasion, and we found the incidence of post-inflammatory hyperpigmentation to be extremely low. That's good because, again, if I can't use this device to treat other skin colors than mine, then this is a non-event. And I tell that with laser companies and laser devices everywhere. If we can't treat other people's skin colors besides mine, you're not going to have a product to sell on a global basis. So this is very safe, it's very effective, it works in all skin types and all skin colors. I can use it for a resurfacing of the skin, photo damage, mild wrinkling, fine lines, those kind of things. Or I can use it for deeper things because I have, again, a superficial component and a deep component. I love these kind of devices for scars, whether it's an atrophic scar, acne scar, or traumatic scar, or a raised hypertrophic scar. Again, I have the benefits of being able to drill as much as I want and then to resurface superficially as much as I want. And so to me, I have the benefit of both worlds. The AcuPulse is an ablative fractional resurfacing device, specifically CO2. It's different than non-ablative in that I usually can get to my end result faster. There is more downtime whenever you do an ablative fractional treatment versus a non-ablative fractional treatment. But it seems that in this day and age, we're doing a lot more of the ablative treatments than we used to think about doing versus when non-ablative first came out. So we're doing many more of them now. And so the big advantage to me is that I get to where I'm trying to get to faster.